Okay, good morning. Welcome. Mark, can you confirm that you can hear me?
Yes,
I
I
can
can
hear
hear
you.
you, John. Thank you.
Okay, thank you. I want to welcome everyone this morning. And as people are joining our meeting, we've got a couple minutes before we actually start. As you are joining, please look in the chat and see the link for a sign-in sheet and sign in today as soon as you get a chance sometime during the meeting. I want to comment that our agenda is very full today. So the chat will be for technical issues, signing in, and volunteering. And as again, welcome as people are joining. Maybe you can take a minute to check the chat for a sign-in sheet. Welcome to our Healthcare for All Minnesota quarterly meeting on this beautiful Saturday summer morning, late spring summer. Thank you again for joining. And a little reminder that the chat will be for today will be for technical issues and for signing in and volunteer opportunities. We'll give people a couple more minutes to sign in. And perhaps while people are signing in, I will review the agenda for this morning. Our presenters are our board chair, Dr. Brockie, our secretary treasurer, Don Pilkinen, our chair of our events for our fundraising and development committee, Rhodes, our executive director of the Minnesota Nurses Association, Dr. Ken Engelhardt, board member of Healthcare for All Minnesota, and Ann Jones-Me, our RN and vice chair of Healthcare for All Minnesota. And our agenda includes a welcome from our chair, treasurer's report, fundraising update. Our main speaker today, Rose Roach, organizing to win the Minnesota Health Plan. Then Ken with building a coalition of allied organizations to win. A legislative report, end of session, and education discussion from Don. And then I will talk about the Education and the Outreach Committee and make some announcements. And then we will do a wrap up. So with that, maybe I'll give it one more minute as people are joining, and then we will, I'll turn it over to Mark. Mark, you can go ahead whenever you're ready.
Okay, I am ready. So I was just going to preface my remarks with mentioning that our usual technical team, Dana Coulthard and now Jessica Kaufenberg, are not present today. So Ann Jones and I are basically functioning as the engineers for this meeting. And since this is a somewhat new role for us, if there are any technical glitches, I apologize in advance. Well, good morning to you all. Thanks for joining us this Saturday morning to talk about how we are going to fix our broken healthcare system. It is wonderful to be no longer masking at the grocery store and out in public, although I'm not sure if any of you have the same feeling I have. I get out of my car at the grocery store and then I think, oh, I forgot my mask. And then I remember that I don't need it anymore. Very good. I'm going to comment on a new addition to our team. Recently, Jessica Kaufenberg joined us. Jessica was originally a resident of Tennessee, but now resides in the metro area with her husband and 2 children. Jessica will be doing some of the jobs Dana Coulthard has previously been doing for us, and Dana will be transitioning to other work for Healthcare for All Minnesota. Jessica has a background working in corporate America, running her own business, fundraising, and work with nonprofits. She will be spending significant time expanding our presence in social media. As I think you all know, more and more information is being transmitted via electronic media these days and less by print. So winning this fight for healthcare finance reform requires our being effective on social media. Related to social media, we also have another new team member, Carolyn Handke, who is a master's degree student at the University of Minnesota. As part of her master's degree work, she is helping us develop our social media efforts, which include Facebook, Instagram, LinkedIn, and Twitter. Moving along to other parts of the agenda today, you are going to be hearing from Don Pilkinen and Carol Engelhardt, who will be addressing finances and fundraising. We are making progress in the challenging realm of fundraising, and that progress is going to help us become more effective in our education and organizing by allowing us to hire more staff to do more field work. And then a little later in the program, Rose Roach is going to be talking about organizing to win the Minnesota Health Plan. In order to achieve change in a world filled with distractions and opposition, it is going to be essential for us to have effective organizing. And then one of the most exciting things we are currently doing is working on building a coalition of Minnesota organizations to fight for single-payer healthcare. And our internist turned social activist, Dr. Ken Engelhardt, is going to tell us more about the project to bring together progressive organizations in Minnesota. So that concludes my introductory remarks, and I will turn the podium over to Don Pilkinen, our Secretary Treasurer.
Okay, good morning, everybody. Can you see me? I see at the bottom of my screen, the start video is crossed out. I believe I'm unmuted, but I don't know if you can see me, and maybe you don't want to see me.
Don, you can click on your start video and
all right,
you'll come up.
I'll do that now.
Okay.
It says I cannot start video because the host has stopped it. Okay, now okay. All right. Okay, I think you can see me, but what I see is the bullets for my report. It's been said that money can't buy you love, but we need it in HCAM to keep doing what we love, which is fighting for health care for all Minnesota and for all of America. I'd like to start by just reporting on the fundraising amount that we have as of today compared to that of a year ago. This time a year ago, our fundraising amounted to $24,100, and that had come in for the prior 12 months. And as of now, the most recent 12 months, it's now at $27,040. So that's roughly of a positive differential of $3,000, I believe. We expect to improve this year with the tremendous fundraising efforts of many volunteers currently working on two great fundraisers that Carol Engelhardt will report on later. Meanwhile, our all-volunteer work on education, outreach, and coalition building is starting to build a statewide campaign for the Minnesota Health Plan and Medicare for All. And some very good news is that the HCAM Education Foundation received IRS 501c3 status in May to qualify for receiving tax-deductible donations. This means that you can immediately make tax-deductible donations by writing and mailing your checks directly to the HCAM Education Foundation. This eliminates the cumbersome process of making tax-deductible donations to the former COACT Education Foundation, from which donations were transferred to HCAM. So there's no longer that middleman hassle that you folks have to deal with to contribute your tax-deductible donations. And donation functions are in the process of being applied to our website, our Facebook page, and Instagram to enable online tax-deductible donations to the HCAM Education Foundation. And this will be announced upon the setup of those donation functions. Online tax-deductible donations to the spring exercise-a-thon, the fundraiser, is already a reality with deposits going directly into the HCAM 501c3 bank account at the credit union. We appreciate the financial support you all are giving to our educational work, and we will strive to ensure that your contributions will have maximum impact in achieving single-payer universal health care. Thank you.
Thank you, Don. Next, you'll hear from Carol Engelhardt, our just extremely hardworking, effective, and enthusiastic event chair and fundraiser. I'm going to stop sharing so that Carol can share her slide.
Good morning. I'm Carol Engelhardt. It's been a journey. So I'll just get going with the PowerPoint, sharing it, and go from there. Okay, from beginning. Can you hear me now? Yes. Okay, we are almost there. We have 7 teams throughout the region that have been working hard, exercising, swimming laps, running, walking, biking, yoga, anything they do. Children on scooters while we go. We've done visibility campaigns throughout the metro and some of the rural areas to say, this is who we are, and we're exercising for a cause because we care that every Minnesotan deserves health care. Can you help us today by going? I'm going to share this screen to, let me see, stop share here. I'll stop share, and then I'll bring it back on. First of all, I will tell you this about our sponsors. Our sponsors that have been helping us with the a-thon are Engage Physical Therapy and Wellness from Excelsior, Gear West from out in Wayzata, Alpha Element, which is a counseling and wholeness out business out in Excelsior, One-on-One Bike Shop right here in Minneapolis, and Smart Set has done our t-shirt design for free. So we're very thankful for them and their help. So I will show you how to give to, I'll end the show right now and go back into this. Hold on. Okay, in the chat, I'm going to give you a link to be able to go directly to our site and give today. Okay, if you see that in the chat, if you go there right now and if you can look where you live, if you live in Angie Craig's district, please give $25 or $50 to Team Northfield. Let's get that over the top today when we have our celebration for the a-thon. We're working hard. If you live out in the West Metro, think of Osseo, Maple Grove, or Excelsior. East Metro, Woodbury, Maplewood, St. Paul, and give to their group. Team Minneapolis, if you live in Minneapolis, give to us. Anywhere out in Rochester, Mankato, Duluth, any place out of the metro, please give to Team Minnesota. That is what we asked for today, and I'd like to see at the end of the time that we can actually see, I will give you live time, that we've made it. We've made our goal, so I ask of you that. Now I'm going to share again with the PowerPoint, starting with this. Okay, so the next thing I'm going to be talking about is, I'm sure you've had emails, Facebook, and everything about an exciting time that we have with Wendell Potter on June 22nd, a live virtual interview. Now, here at Healthcare for All Minnesota, we've had a lot of free educational events. This time, we're asking for you to pay. It is a combined sponsored event with Center for Health and Democracy, Healthcare for All Minnesota, and Physicians for a National Health Program of Minnesota. So what we're asking you to do is register right now at this meeting. Share it on Facebook. Invite your neighbors and friends and get people to come. It's really important that we get turnout for this. Right now, as a combined effort, we have around 66 people either registered on our direct site through Every Action, or so then we have about 66 people. Some people have given directly to a forgiving site that we have up. Many people have given tickets. Now, when you go to hcamn.org, and I put that in the chat, you can either give money to the a-thon or you can register for the ticket right now live at this meeting. And won't you join us to help us? And I say this because as a personal friend of Nicole Smith's, I'm going to her event tonight. I'm not going to call it a celebration. I'm not going to call it a party. What she's doing is she's having a backyard event to remember her son, Alec. And she and I have become close over the years, fighting and being activists so that everybody can have affordable insulin in the state of Minnesota. And I'll tell you, that lady did not give up. She did not give up, even with the current Senate we have right now in Minnesota. And let's do this for Nicole and her family. Let's buy a ticket today so that we have the funds to fight big money. We are the taxpayers, we are the patients, we are the voters. And let's remember that. So then I go on. Right? Okay, I'm going to go back into here to get back into my, okay. So I'm also going to have us get onto this. If you can see this, we really need help with turnout. The way we are going to get people to come is share the personal story with neighbors and friends. We've actually had good luck with the a-thon going straight to Minnehaha Falls, going on the parkways, talking to people in the neighborhood. We actually got several people to give a few $100s each time we did that. So we will be going to Lake Harriet tomorrow at 1 o'clock at the band shell. And if you want to join us, just come there. And we'll be doing flyer distribution for Wendell Potter. We'll also be at Summit and Mississippi River Boulevard in St. Paul at 10 a.m. Saturday, June 19th. But the biggest thing you can do too is, like I said, register yourself today during this meeting. Invite a friend, family member, or colleague. The other thing we're going to do is phone banking. We're very fortunate Renee Carterell has been able to set up every action so that now we can do specific phone banking. We will be doing this on Tuesday and Thursday evening of this next week. And once you're trained, you can phone bank on your own. So if you could sign up for that, we'd greatly appreciate it. And I will make a copy of this and put it in the chat right now. Click and then go to the chat. If you can see that there, that's what the phone bank looks like. And I will, here. So I will go into the chat right now. While I will get that form in there so I do not delay the meeting and work on copying it and paste it in there. But this is what we want to know, is that we need you. We need you now. And I have one last thing to share. And that would be, we have a very exciting event coming up September 9th. Papa John Kolstad has contacted us and Mary T that they want to do a music night for us at Crooners. So that is really exciting news to share. We will be sharing with you in the next few months registration and how to buy the tickets for this event. You come early, any of your food and beverage, a percentage of that will be given to Healthcare for All Minnesota. And we're so delighted to have such a skilled musician and a heart of gold, caring about everyone getting healthcare when they need it. So share that with your friends and we'll be giving you more information. Stay tuned. We're on the move here with a lot of exciting things to do. Thank you for your time, and I'll work on getting that into the chat for signing up for phone banking. I really could use a core group of 5 to 10 people to be able to phone bank this week, because how we get this word out is directly to the people that care about our movement. And we already have the script set up, so it's really easy. And my husband gave me a little yellow note, and the goal we had for the a-thon is $10,000, and we're just a little over $1,000 short. So people on these teams have worked so hard, and I'm so grateful to all the team leads and team members. So let's see if we can do this over the top. We're going to do it next year too. This will be an annual event. So let's see if we can make 2021 a record year. Thank you, and I'll see you at the end of the meeting to see if we have more registrants for Wendell Potter and we've had more money for the a-thon. Thank you.
Thank you, Carol. Carol has certainly added so much creativity and color and interest to our work. I did catch a couple of notes in the chat, and we will respond to that. And next, it is my pleasure to introduce Rose Roach, Executive Director for the Minnesota Nurses Association and board member for Healthcare for All Minnesota. May I say it, Rose? And single payer warrior who's going to talk to us today about organizing to win the Minnesota Health Plan and eventually Medicare for All. Thanks, Rose.
Thanks, Anne. From one warrior to another. Good morning, Healthcare Justice Allies. Greetings as always from your nurses. It is a great day to organize for Healthcare for All. So I am going to share some ideas on the screen here, and I want to make sure to share sound because I'm going to show a brief video at one point as well. So it's always confusing to me how to do all of this on this screen and not have things in the middle of it. There we go. Hopefully this will work. So again, good morning. We're going to talk first a little bit about some ideas around messaging and narrative. Changing our healthcare system is really about these one-on-one conversations. We just have to realize and recognize the importance of those one-on-one conversations to bring people, to meet them where they're at and bring them into our movement, to engage them and get them to action. So with that, I want to, the fundamental problem, and are you all seeing this goofy stuff that I have at the top of my screen that's still the Zoom stuff that's blocking some of my presentation, or is that just me that I'm seeing it? Because you can't see my whole screen. So hopefully it's just me. The fundamental problem we know with our healthcare system is how we finance it. Or maybe even how we don't finance it properly anyways. So of course the economic impact and the economic self-interest for people is really an important piece to this discussion. But as Russell Hochschild discovered in a book that he wrote is, now what? Now why is this not working? There we go, was that what really is profoundly important is emotional self-interest, that the abstract data doesn't mitigate our real life frustrations and experiences. And that's why it's so important for us always to relate to how is the system working for you and or your family and loved ones, or how isn't it working? So think about it this way. It's really important that we keep in mind when we're getting into conversations one-on-one with individuals, we want to make sure that we're not letting that conversation lapse into losing my insurance, or losing insurance company jobs. We want to think more about steering that conversation back to what are we going to gain? So gain versus losses. So things like if we save, we could save money for other things instead and say, stop wasting our money. How about instead of saying that, we're losing something, we're actually wasting money in this current system. It's not going to healthcare. That's what we want, where we want it to go to. So let's save money in this system, make sure that those dollars are going to healthcare. At the same time, let's use any leftover money, because we're going to save money under the new system. Let's make sure that we use that money on other things that we so desperately need in our, in our society. A gain message is that we get to see any doctor that we want. We go to any hospital, any facility. So think about it in saying, when you're thinking about the loss-centric message, don't let anyone take away your choice of doctor. Why are we letting insurance companies dictate to us where we can and can't go to get our health care? We don't want to let them take away our right to choose whatever doctor facility that we want to go to. So you flip that script, right? You flip the narrative on it. And another one is, you know, we say, hey, we're going to live longer and healthier under a single payer type system. The loss-centric message is a little more blunt, but it's so true, right? Stop dying younger than we need to under a system that puts an emphasis on money and profit before it does on patient care. So, you know, just loss aversion, losses generally count double gains. So that's why we always have to be really, really conscious about what is that loss-centric message versus the gain-centric message. You know, Milt Friedman, the free market guru, right, had said the single most important central fact about a free market is that no exchange takes place unless both parties benefit. Well, that's an interesting perspective when we think about free market healthcare, because actually single payer is the really good free market healthcare to operate under that theory, because guess what? We have people who pay into a system, they get the card, and then the system pays our providers. So you see, the money actually follows the choices of the patients, and there's no exchange that takes place unless both parties benefit. Both parties benefit under this system, not under the one that we currently have. We often talk, particularly those of us who are a bit more left-leaning, we've talked about this a little before, about healthcare being a human right. And we're all very comfortable with that and believe that to be the case. Doesn't always work in, you know, framing and conversation when we're talking to folks who might have a little bit more of a right-leaning perspective on this. So instead of, you know, connecting to fairness and caring, which I will argue we are lacking greatly in our society these days, maybe start thinking about tapping into loyalty to one another, to our families, to making sure that we are good stewards of the money that is going into the system, something like a common good, right? The American dream is about making sure that we have things that are shared that are a common good amongst us. So healthcare, of course, is a common good. So why single payer? Well, here's a couple of really easy ways to talk about it. It's really simple. It's really comprehensive. And a big issue these days, no copays and deductibles is important, but this we're reading about practically daily, right? People getting surprise bills, even getting treated for COVID. Surprise bills. How crazy is that when you're fighting for your life? Again, never letting anyone take away our choice of doctors or facilities. Everything that we've tried to date, everything has been significantly more expensive and wasteful. We know that this kind of a financing system is going to save us money, and it's going to improve quality of care. It's going to cover everyone. And most importantly, it's going to save lives. And, you know, again, no matter which ideology, political ideology you happen to favor, we still to this day, when polling is done, people really do believe, with its flaws, and we know that it needs to be improved, which is why we say an improved and expanded Medicare for all, that Americans are proud of the Medicare program. The Medicare program saved enormous numbers of lives in this country once it was implemented. And we can do it for everybody without a qualification of an age or a disability. So I also want to transition now into just, you know, kind of focusing on two really major sort of sectors, I would say, that we talk to a lot, right? We usually fall into one of two of these, unless we're lucky enough to be retired. We are either a worker or we might be an employer. So let's think about what are some of the reasons why, first, workers really should support single payer. Well, because it takes the control of healthcare away from our employers. Tying it to employment is absolutely insane. I don't know how else to say it. Think about what we just experienced with the pandemic, where people were being laid off or losing their jobs, which was their access to healthcare during a global pandemic. What sense does that make? And if you happen to be in a union, this eliminates the need for us to have to sit there and scream and yell at each other over the bargaining table about health benefits. Workers can refocus on some of the core labor management issues. We can get back to talking about wages. We can get back to maybe considering defined benefit pensions again in this country so we can actually have a dignified and secure retirement. We could talk about child and elder care benefits. These are really important to the young people coming into the labor market, and even those in that are in the middle ages now, you know, in the sort of, maybe not middle age, I shouldn't say, but in the 40s or 50s, taking care of then their parents. Elder care is an issue. We could start to talk with our employers about those being benefits instead of this horrendous beast we carry known as health insurance. We could look at improving working conditions like paid family leave, also something that is desperately needed within our society. And it offers a more complete coverage. Single payer does, because right now we all know that we're having to deal with, well, is it only the employee that gets coverage, and then you've got to pay $1 bazillion if you want to cover your spouse or your entire family? Almost everybody has some level of copays and deductibles in this day and age. Again, the networks get dictated to us, and our healthcare health, prescription, dental, vision, hearing, long-term care would be covered under both the state and the national plan that we're talking about here. Those are not generally covered under your medical plan with your employer now. So looking next at what maybe are the reasons why an employer should actually consider supporting single payer. We got the top 10 on this one. It reduces liability insurance and workers' comp costs. It eliminates the headache of running a healthcare benefits bureaucracy inside of your business with annual negotiations with insurance companies, et cetera. It eliminates complaints by employees over the rising costs, whether they're out of pocket, whether they're premium, whatever. And it sure would be nice to have removed this conflict within the labor movement over benefit cuts and givebacks and et cetera. It reduces the incentive to hire part-time employees because we want to have a robust workforce where the benefits can benefit the business, the worker, and our overall economy. And it ends health-related bankruptcies. So it reduces health spending by low-income workers, and it frees up that money for consumer spending. Again, that's a positive for our overall economy. We also look at it in the way of reducing costs of providing health benefits for those employers that are now providing benefit coverage, because some are, some aren't, and it becomes a very heavy line item on the balance sheet. If your employer happens to provide retiree benefit costs, those are skyrocketing. This could remove that particular obligation again from the balance sheet. It eliminates unfair competition from employers who don't provide health insurance benefits. It reduces absenteeism. You have a much healthier and more productive workforce. And most importantly, it will allow healthcare costs to be controlled and predictable. This is something that is also really difficult for businesses on an annual basis to figure out how to even budget for this particular expense. So when we think about where the focus should be, try thinking a little less about, the big scary words, taxes and trillions of dollars. Let's really focus on what are we going to get? What is it going to mean to us to have something different when it comes to a healthcare system? How about we have healthcare assurance instead of healthcare insurance? Because after all, a healthcare system should be focused on what? It should be focused on patient care. Racial and ethnic disparities resulting from institutional racism, including the historical underfunding of care for communities of color, ongoing wealth and income gaps, and suppression of voting and political power to address these inequalities, have led to higher rates of morbidity and mortality for Black and Brown Americans. In addition, historical forces that led to disproportionate representation in lower-waged frontline jobs and increased the risk of overcrowding in workplaces and in homes in many parts of the country meant that more people of color in these communities had a higher likelihood of contracting the coronavirus. I'm going to share with you a short video produced by Healthcare Now that provides much needed but seldom discussed history of how racism has and continues to permeate our healthcare system, a system literally built on white supremacy that to this day delineates care based on race. Remember, we know that when it comes to healthcare, illness, and injuries, there's only one race, and that's the human race. So I'm going to cross my fingers and hope this works.
Among high-income countries, universal health care is standard, except here in the United States. Why is that? Here's a reason that you may have never heard before. Our failure to pass a national health plan is largely due to America's history of structural racism. In 1945, Democrats were in control of the House.
Rose, I can hear it, but I can't see.
President Harry Truman decided to push for national health care.
Okay. Let me stop it a second. Maybe what's happening, I'm so sorry, everyone. I'm trying to remember to do sound in addition to, I guess I need to also share my screen on this. So forgive me. Technology occasionally still stumps me. Let's see, why can't I get back to, I think maybe what I need to do is exit this and see if I can go to a new share. And let's try this one more time.
Among high-income countries, universal health care is standard, except here in the United States. Why is that? Here's a reason that you may have never heard before. Our failure to pass a national health plan is largely due to America's history of structural racism. In 1945, Democrats were in control of the House, Senate, and the executive, and President Harry Truman decided to push for national health care. That year, 64% of Americans supported a national health insurance plan. Support in the states' rights South, which was heavily Democratic at the time, was even higher than the national average. Seem too good to be true? That's because Truman's proposal would have expanded health coverage through Social Security, which at the time explicitly excluded agricultural and domestic workers. That meant 60% of Black men and 80% of Black women were not eligible for the benefit. However, the push for national health care coincided at a time when challenges to Jim Crow and discriminatory provisions in federal programs like Social Security were also underway. In 1946, Truman established a Civil Rights Committee, which desegregated the military and banned discriminatory hiring practices in the federal government. Southern elites began to link new proposals coming out of Washington with threats to segregation in education, healthcare, and housing. The possibility that a national health plan would desegregate the healthcare system and institute a significant transfer of wealth from whites to Blacks caused Southern support to plummet from 66% in 1945 to only 22% 4 years later. Southern elites were a core constituent of the Democratic Party at the time, and nothing could be passed without them. In 1949, around the time every other wealthy country was moving towards universal health care, the Democratic coalition fractured and Truman's plan in Congress died. In 1964, the NAACP won a landmark Supreme Court case requiring hospitals built with federal funds, which was most of them, to desegregate. A few months later, the Civil Rights Act was passed, reinforcing this mandate. Passage of a true national health plan was still blocked by Southern Democrats in the 60s, since after the Civil Rights Act, this would have meant desegregating the entire healthcare system. So in 1965, the Southern delegation finally came to the table to negotiate the creation of two groundbreaking, yet limited healthcare programs: Medicare, which initially covered only seniors, and Medicaid, a state-run program for certain groups of low-income people. The Dixiecrats ensured that these programs were designed as much as possible around the racial hierarchies in the healthcare system. For example, Medicare is split into two parts. Part A, the part that covers hospital care, requires no premium. Medicare Part B, the part that covers physician care outside of a hospital, does require a premium. Why split Medicare into two parts? Part B was designed this way so that physicians' offices in the South could claim that it was a voluntary insurance program, not a direct government payment, and continued to racially segregate their offices and refuse Black patients. And why was Medicaid created as a federally funded but state-administered plan, while Medicare was administered by the federal government? This compromise allowed Southern states to discriminate against low-income people of color in terms of eligibility as well as benefit levels, and this also dramatically slowed the desegregation of nursing homes. While Jim Crow laws no longer exist, the impact of structural racism on our country's healthcare system has been profound. People of color are still overrepresented in states that have poor safety nets and strict Medicaid eligibility requirements, and new waves of immigrants, particularly Latinx, have fallen into these systems of racial inequity created for African Americans. True national health care, like Medicare for All, was blocked by segregationists during the post-war period when the rest of the developed world was establishing health care as a right. By the 1970s and 80s, a large healthcare industry and lobby had emerged, making passage of national health care more difficult and likely requiring a massive social movement. It's time to atone for this ugly chapter in our history by building that movement and guaranteeing everyone health care from cradle to grave.
So, isn't that interesting? I don't think we really think about that impact as much as we need to, and the importance of dealing with it when it comes to our conversations about healthcare for all and what that truly means. You know, I want to remind everyone that prior to 1973, it was illegal in this country for healthcare to operate on any kind of a for-profit system. So how does this relate back to Medicare for All or the Minnesota Health Plan? Well, if we're going to provide truly universal coverage, that means it's everybody, and everybody means everybody, and we remove all of the barriers that exist right now to people being able to access their healthcare. We start to regionally do healthcare planning so that we can make sure that the communities that are most in need get the services that they require and that they deserve. So let's see, I gotta switch again here. There we go. So now I want to switch over just a little bit to have a little conversation about some messaging tips. I think we all know the power of stories to move people, and the power of stories to move policy. So remember, leading with real life stories is important, and it can really make a difference. Start with what we get. Don't be focused, try to switch the conversation when people say, but what about, we're going to lose this, we're going to lose this. Let's talk about what we're going to achieve and what's going to be different and what we're going to really get out of this new system. Let's remember that no one should have to go bankrupt just to try and save their own lives. And that what we're doing here is we're just expanding something that we know works. We know that it needs to be improved too, but we have a Medicare system in this country, and overall, it works pretty darn well. And let's also remember that public health connects us to one another. Whether we like it or not, it's a fact. So caring for one another actually is caring for ourselves. We know that we're getting pitched these days a whole lot of variety of different sort of solutions and fixes to the healthcare system that we currently have. Here's 5 questions to ask when those proposals come before you. Does the plan cover everyone with no exception? Does the plan cover every medical need that the patient has with no first dollar out of pocket? Does the plan lower healthcare costs, not insurance premiums, healthcare costs? And if so, how does it do that? Does the plan allow patients to get care from whatever health professional, clinic, or hospital they choose? And does the plan allow the patients and their medical professional to make care decisions independent of health insurance companies? I throw these up here because when we get thrown, proposed some of the public options or Medicare Extra or all these different things that, folks are coming up with, ask these questions. And if it isn't yes to the 5 of these questions, we have to think about whether or not is it even leading us on a path to get to where we all know we want to be, which is true guaranteed health care for all. You know, in labor and even in nursing these days, we're using something called the SBAR system. So the S stands for defining your situation. The B stands for providing a little bit of background. The A is doing an assessment, and the R is let's try to see if we can't offer a recommendation. So I'm going to go ahead and do SBAR for our organizing to win single payer. So the situation, we know what it is. We got to pass a bill, and we got to get it implemented that creates a just and equitable healthcare system for all. We've got to build support for that bill, and we got to do that by putting massive amounts of pressure on state representatives and senators, also our national representatives in Congress, and the candidates who are going to be running for those positions. And we need to get the bills to have fair hearings. We've got to get hearings in all of the legislative and congressional committees that would have oversight of those bills. So the background is we know that people are suffering medically, emotionally, and economically from our current system. And we know that what needs to be done to get a true healthcare justice system in place is we have to build the movement in order to demand that it happens. So the assessment of this, again, pretty straightforward. Polling shows there's an awful lot of support to move to this system, and it continues to be strong. As a matter of fact, it's never been stronger. The pandemic exposed the failings of this system that centered money over people. We have, there's a huge but relatively untapped capacity in the grassroots. They are ready to be called to service. We just have to make the ask. And we are experiencing an historical moment right now. We must not let that moment go again like we did after World War II, when, as the video said, the rest of the world was implementing some kind of a national healthcare program. So what are the recommendations? It's simple. Let's create organizing opportunities. Let's invite neighbors, families, and friends to come on over, have a coffee clatch, whatever you want to call it, and center the discussion on how the current system is or isn't working, and then make an ask at the end. Simple, just ask them to call their state rep, senator, or their congressional representative, or even our 2 United States senators, and ask them to support the single payer bills that are before these bodies. The federal bill is HR 1976. Bernie's hoping to submit the Senate bill, which we know has some problematic stuff in it, but that bill, maybe we can get him to change it before he drops it in the fall. And in the state, it's Senate File 1643, excuse me, and House File 1774. We want you all to come work with us, work with HCAN to organize bigger events in your area, a healthcare town hall or a forum where we can recruit volunteers to actually begin to engage in this campaign to win, particularly here in Minnesota, the Minnesota Health Plan. And then consider being a volunteer, recruit volunteers, because we're going to be putting together a campaign, we hope, that is going to be literally door-to-door canvassing in your neighborhoods to ask people to talk about the healthcare system, get their healthcare story, and then we're going to ask them to help and put pressure on those elected officials. I want to give you an example of, when we organize, we talk about strategies and tactics. So here's a little bit to think about in regards to designing what a strategy looks like versus what a tactic looks like. So our end goal is to pass and implement the Minnesota Health Plan by 2025. Because remember, we're talking about the session that starts in 2023. It's going to take a little time to get it through and pass, and then to put the system in place and actually have it ready to work. So a strategy might be that we need to increase the grassroots movement of volunteers. We know we need to do that. That starts now, goes through election of 2022. A tactic would be relationship building with healthcare justice ally organizations to engage them in the campaign and engage their constituents. Another tactic is to have those healthcare justice town halls and forums. Another one is to, as I said before, canvass those neighborhoods, phone and text bank. A strategy would be, got to up the ante on public relations. Got to get the message out there, right? Not just by the one-on-ones, but on a bigger scale as well. So let's fundraise so we can buy some billboards. We could do some social media ads. They're very effective. We want to create earned media opportunities. Let's go pick it outside of Blue Cross Blue Shield, or better yet, with what that crazy United Healthcare health group is doing these days around not wanting to pay for emergency room visits, because, you know, as the patient, you're supposed to be able to figure out whether or not it was an emergency. Another strategy might be to, it is, we know it is, to elect pro-Minnesota Health Plan candidates to the legislature. What are the tactics? When that candidate has any kind of an event, show up at it, make sure to get in the queue and ask them whether or not they support the Minnesota Health Plan. If they do, have them articulate why they do and why we need it. Use it as an education opportunity. And then, of course, got to volunteer. Can't get those folks elected unless we're out there talking to people and helping them actually get the votes that they need. So I want to just take a little bit of time before I wrap up here to talk about the single payer universal healthcare bill that was just recently put forth by Representative Ro Khanna out of California. It's House File 3775. It is possible for us to chew gum and walk at the same time. So yes, we are going to work on the Minnesota Health Plan, but of course we are always going to want the entire country to be covered by healthcare, guaranteed healthcare. So we also want to make sure that we, at some point, whichever one comes first, we're good with. But if we start in the state, that's okay. Then we work to win it for all the states in the country. The State-Based Universal Healthcare Act actually will help us at the state level. It helps us take all of that money in the federal system that we get, Medicaid, SCHIP, ACA subsidies, and put them into our Minnesota Health Plan funding system. It would also give us waivers to be able to deal with things like ERISA on the state level. This is a organizing that is going on and supported, and similar tactics by, National Nurses United, One Payer States, Healthcare Now, Public Citizen, Labor Campaign for Single Payer. Representative Jayapal is working an inside-outside strategy. And then, of course, Wendell Potter's A Business Initiative for Health Policy. So we want to make sure that our congressional representatives support this. So it's another lobbying opportunity now that we have Representative McCollum on the Medicare for All Act bill in Congress. Let's get her on this one too. She has often said she believes it might have to start in the state. Here's her opportunity to show that. So I quoted Kip, and I think I'm not sure if you're still here, Kip, or not, but some people say, geez, if we were to go ahead and also put into the American Families Plan, the big legislation that they're trying to get passed in Congress, also expanding Medicare coverage, eligibility, dropping the age, and maybe including things like, oh my gosh, vision, dental, and hearing, and being able to negotiate drug prices. That wouldn't be a bad thing. And some in the movement are saying, yeah, but is that a step towards Medicare for all? Or, could that impede Medicare for all? The answer is it's absolutely a step towards Medicare for all. As Kip says, improving Medicare's coverage, even without lowering the eligibility age, would almost certainly make it harder for the Medicare Advantage, the privatized plans, to lure beneficiaries out of our fee-for-service Medicare. Doing that and lowering the eligibility age would be an even bigger step in the right direction. Doing that and limiting the size of the payments to the Medicare Advantage plans would be an even bigger step. And doing all that and prohibiting the privatization of Medicaid would be an even bigger step. They're all incremental steps, but they're all in the right direction. So I'll just end by saying what I've said a million times before. You've all heard me and probably seen this slide. You can't cross a chasm in small steps. So let's reject fear. Let's reject hopelessness. Let's encourage everyone to join together and create the healthcare system that we all need and deserve, healthcare justice for all. Thanks, everyone. Hope this was helpful today.
Thank you so much, Rose. I am inspired, as always, when I hear you. And thank you for kind of helping start adding more detailing and creating that roadmap that we need going forward. Thanks so much. Next on our agenda today is Ken Engelhardt, board member, and kind of leader on our building a coalition of allied organizations. We can't do this alone. We are going to have some effective partnerships.
Thank you, Ann. Well, I'm going to take 15 seconds of the time I'm allotted to make a pitch for the a-thon. I've been going to the gym every other day as a participant, and our goal for this a-thon, which by the way ends today, is $10,000. And as of this morning, we were just a little over $1,000 short. So help us reach that $10,000 goal. Keep me going to the gym every other day, and go to hca-mn.org and make your contribution so we can hit that $10,000 goal. So thank you for that. I'm going to now actually talk about what I was assigned to talk about, which is our coalition building. And I'll just, I guess, start at the beginning. In late 2020, Dr. Brockie, the chair of HCAM, asked me if I would lead a group to review one-page sheet, which was part B of our HCAM work plan. So we started innocently enough looking at that plan, and then we realized we were talking about setting goals for the number of alliances that we would build and the number of chapters that we would support and develop. And we asked ourselves the question, well, who's going to do this? And then we realized, well, I guess it's going to be us. So we went ahead and developed a coalition building team. And I'm so grateful for all of the members on the team. And I'd just like to take a moment to recognize them all. First of all, it's Dr. Brockie, the chair of HCAM, is on our team, as well as Ann Jones, my wife, Carol Engelhardt, Linda Gridley, Cora Ektanafong, Cheryl Quick, and Rose Roach. All of them are just so helpful and have served as liaisons to the various organizations that have become our allies. And I just can't thank them enough. I certainly didn't know all of these organizations, and their help has been tremendous. We've also been getting help from Ben Day with Healthcare Now in terms of organizing advice. Dr. Ron Jankowski is a former chair of HCAM, has also given us some guidance, and we've gotten some guidance on rural Minnesota from Renee Carterell, who's lived in rural Minnesota and has run electoral campaigns for herself in that area of our state. So we had our first meeting on May 24th of our allies, when 20 allies committed to that meeting. And I'll quickly run through the list of who they were. It's Growth and Justice, Main Street Alliance, Metro IBA, Land Stewardship Project, Minnesota Association of Professional Employees, Minnesota Farmers Union, Minnesota Nurses Association, Minnesota COACT, Our Revolution Minnesota, Our Stories, Our Health, PNHP Minnesota, SEIU Healthcare Minnesota, Take Action Minnesota, Twin Cities DSA, Voices for Racial Justice, the NAACP, COPOL, which is a Latinx organization, Centro Tyrone Guzman, another Latinx organization, SEIU Local 284, and the League of Women Voters Minnesota. So 20 organizations committed to that May 24th meeting, and 16 were able to attend. During that meeting, we quickly ran through a really whirlwind summary of US healthcare, where we are now, and how our current, if you want to call, system of healthcare in the United States intersects with the costs that we have to pay, our outcomes, which are mediocre to poor as a population. Also how our healthcare system intersects with race, rural America, small business, the pandemic, and what corporate health insurance is doing to us. So we also achieved a commitment from all 16 organizations who attended the May 24th meeting to attend a second meeting to begin the discussion of a campaign structure to win a just healthcare system for our state and nation. And that meeting is now scheduled for July 15th. And we're just beginning to put the agenda together. So we're really happy with what has happened so far. The feedback from the first meeting on May 24th was very positive, and we just want to keep this momentum going. We want to increase our movement. We just want as much representation as we can get from every Minnesotan, no matter who you are, We want it to be diverse. We want a grassroots, people-powered movement that's just massive to overwhelm the reality of what we're facing. So we as a health coalition team aren't blind to the fact that we have huge obstacles to overcome. You know, the insurance corporations have us just where they want us right now, and they don't want any change. They will oppose any change. They oppose the ACA. They're going to oppose a public option. They're going to oppose single payer legislation like the Minnesota Health Plan and Medicare for All. No matter what it is, they're going to oppose it. So we need to know that right off the top. And another way they have us where they want us is not only are they taking more money out of our pocket in terms of increasing premiums, co-pays, deductibles, and those types of things, but they're also convincing the federal government and the state of Minnesota to subsidize them with our taxpayer dollars in ever increasing amounts, even though these corporate insurance companies are making record profits. And the supposed reason for taking more taxpayer dollars from us is that they want to keep the health premiums affordable. Well, how does that align with making billions in record profits? Why can't you just take the record profits and make our premiums more affordable? So they have us where they want us. They're going to put up a big fight. We know that, but we have the people. And what we need to do is just get those people organized. We know that less than 1 in 5 Americans think our healthcare system is working well. And we know that polling shows that the majority of Americans favor a single payer system like Medicare for All. So it's going to be big organizing versus big money. And if you know of any organization that definitely wants to join this group of key allies, please let us know, and we'd like to add them on. We plan on increasing our numbers and just keeping this going forward. And Rose, who I'm so grateful for with her expertise in organizing, has already outlined some of the strategy for you. And that's what we intend to do. So thank you for your time and your attention, and I hope you have a great weekend.
Thanks so much, Ken, and thanks for your leadership on this as well. Next, we'll bring Don Kilkenin back, Secretary Treasurer of Healthcare for All Minnesota, and our liaison from the board with the Legislative Committee. For a end of session report on compliant education. So, Don, go ahead.
All right, thanks, Ann. And bravo to Ken and Rose for their very inspirational and informative presentations. The community organizing that they laid out applies to our legislative effort, because the February legislative report that I gave back then at the beginning of the 2021 legislative session forecasted the political reality of a divided legislature that would obstruct movement on our legislation. And so what Rose and Ken powerfully and eloquently laid out is the need for people power to open those closed committee doors at the legislature. And later on in my report, I'm going to talk about our city resolution campaign to bring our resolution for the Minnesota Health Plan and Medicare for All to the city councils in the cities where we now have activists working on the resolution process. So we're not being stymied just because there weren't any committee hearings last session on the Minnesota Health Plan, which was introduced along with the stepping stone bills of a cost study to show cost savings and primary care case management to end HMO contracts with medical assistance and MinCare programs. So Senator Marty said that there wouldn't be any committee hearings, but nonetheless, those bills were introduced. Senator Marty did offer the cost study as an amendment to the Omnibus Health and Human Services Bill on April 29th. And I guess not surprisingly, it failed on the Senate floor on a mostly party line vote of 32 to 35. And our invitation to meet with Representative Jennifer Schultz to discuss questions that we have on the public option in her MinCare expansion bill, HF 11, received to date no response from her. So we're not letting this throw us off our stride in our legislative effort. The HCAM board and legislative committee members, following a February strategy meeting with Senator Marty, accepted his offer to help arrange education sessions for legislators on the causes of the state's healthcare spending crisis, followed by the principles and cost savings of single payer as defined by the Minnesota Health Plan. After the legislative committee and board discussed the specific manner of this education, it was decided that it be done by a series of tutorials by Kip Sullivan for both legislators and constituents during this legislative interim to enable factual and constructive discussion on the state's spending crisis and the solution that we all know what it is. We and Legislative Committee Chair Mark Peterson are close to completing the slides for those tutorials. So even the 54 legislators who have already signed on to the Minnesota Health Plan may want to get the tutorials in order to become stronger advocates for the bill with colleagues who haven't signed on yet. And that's onto the Minnesota Health Plan. At the beginning of the session, Senator Marty did mention the prospect of a Minnesota Health Plan Legislative Caucus due to more progressive legislators such as Senators Jennifer McEwen and Stewart Johnson and Representatives Cedric Fraser and Liz Bolden. And Kip will work with Senator Marty to arrange the tutorials for the legislators, possibly beginning with those who have already signed on and want to become even stronger advocates with their colleagues. Tutorials for constituents will begin in August with a history of the creation of our costly healthcare system. This will be followed by tutorials on the lingering, uncomfortable truth of Minnesota's high costs, the true causes of those high costs, as opposed to false causes such as overuse by patients. Excessive price as the correct diagnosis and alternatives to the managed care system that has failed to contain the costs. Furthermore, even though the hearings on the Minnesota Health Plan, as I said before, were shut off at the state level by a divided legislature, HCAM activists are undeterred. They've been working at the city level to get their city councils to endorse our resolution for the Minnesota Health Plan and Medicare for All Act, and to lobby their legislators to support those measures, which has already been passed by the St. Paul City Council, was unanimously and enthusiastically passed last August to the work of Linda Gridley, Rose, and other activists. This is being followed by others who are working to get the resolution before their city councils, including Steve and Joan Janis in Northfield, Carla Sand in Maplewood, Mark Friedman in Mankato, and Jerry Witt up in Duluth. So at July 8th, that's a Thursday evening, July 8th, 6:30, at a workshop, they will share their work in the resolution process with those of you out there now who want to get the resolution before your city councils. Most policymakers, whether willfully or passively, have been avoiding their responsibility, their public duty to fix our high-priced, unaffordable, broken healthcare system. So the solution, coming from the legislators' hometowns, will tell them to do their job by working for the Minnesota Health Plan and Medicare for All to provide health care for all of us. Thank you.
Thank you, Don. I'll just comment that we have two volunteers, Hillary Bestie and Judith Moore, also working in St. Louis Park. So
great.
For more information on that. Okay. So I'm going to talk about sort of putting some of these, what you've learned today into operation a little bit at the grassroots level with base building and some education. But before I do that, I want to just talk a little bit about what we saw in the news just this week. I just happened to have made this slide up a few months ago. Some of you may have seen the article in the Star Tribune this week about an announcement that the largest health insurer in the country, based right here in Minnesota, will be reviewing claims, as Rose referred to earlier, for ER visits to determine whether or not they will be deemed justified before they cover the cost. This isn't exactly new. Even with insurance company regulation under the ACA, these companies have found ways around covering claims or denying or denying care. This is rationing by any other name. So if you think you need to go to an emergency room, or if you are transported to an ER, some untrained clerical person sitting at a computer has the authority to substitute their decisions about coverage for the judgment of the clinical caregivers at your bedside who evaluated and treated you in person. This is just another reminder that United Health Group and the commercial insurance industry is a business, one in which the top 6 executives pull down $162.4 million in compensation annually. They are paid to pay attention to the bottom line of the company and shareholder return. They are not they're not part of our healthcare system. They're a pass-through for money. They're skimming a whole lot of money on the way through. This is where a good chunk of our healthcare dollars go. It should make us all angry to see this. This will not change until we get the commercial health insurance industry out of our healthcare system. And you can read more about how healthcare became a big business in this book by physician and journalist Elizabeth Rosenthal. So what can we do about it? You've just heard a great discussion from Rose on organizing to win, on some of the strategies and tactics we're going to need to use. And yes, it'll probably involve us getting into the streets. But Healthcare for All Minnesota as an organization, along with Minnesota Nurses Association, PNHP in Minnesota, and we hope others come along with us. But we exist as an organization to make the actions that Rose talked about happen. We educate, organize, and work with legislators to pass and implement legislation that we want. Our job is to bring more people to the fight. You've seen me show this slide many times before, but I hope I can make it actionable and live as we look at some of these opportunities to organize out in the field, especially as it becomes a little safer to get out around people and in the public. So these are the kinds of activities that we can all engage in to further this work. And we're going to have to educate and engage and build our base. We're going to have to learn how to have those one-on-one conversations. where we combine facts and values. We need to table at events and forums. Northfield led the way this year, I think. I want to lift them up with an event on Earth Day, and have more planned. And I think I hope everybody's inspired to do something similar around the state. We need to have forums, rallies, actions, town hall meetings. We need to train and build the skills of volunteers to act and influence. It is tough to talk about this issue. It's a highly charged issue, but the more we know, train and provide more speakers. But there are lots of other tools to use besides just personally public speaking. We have lots of materials and tools, including videos and slide presentations and so on. And we need to organize actions to promote change. We need to link effectively with other organizations. As you can see, we're working hard on that. Interact with elected representatives on health policy. The more we know, the more credible we will be. And again, if you help with campaigns, they don't forget you. Hold candidates accountable for reform. We may have polls and surveys on our side, but we got to get people, and we got to create the political will needed to pass and implement legislation. We have to get people to vote this for people who will actually work on this with us and will actually commit to voting for and passing that legislation that we need. Again, we're going to have it's going to take lots and lots of conversations with our friends, our neighbors, our coworkers, voters, legislators, candidates, business owners, other organizations. We have one tool that we can provide for you. That this is a form that's one way of keeping track of the people you've talked to on this issue. It's kind of a personal networking form. I use it myself. We'll send this out with the post-meeting information. And these are some upcoming events. On our calendar, Tuesday, again, June 22nd, 6:30 p.m., a really important fundraiser. And we need you to go to our website to purchase tickets. Please share this with others. We also will need phone bank volunteers, as Carol announced I think she put a form in the chat. If you can see the form, please fill that out. Otherwise, put your contact information in the chat that you're ready to volunteer to help us with turnout for that. This is an important event, and Wendell Potter is a really interesting speaker and an important voice in this fight. Thursday, July 8th, Don referred to the City Council resolution workshop that we're planning. It should be pretty interesting. We're going to have some content and step-by-step, and also hear from people who are already working on this in their local areas. On August 12th, which would be the next month, we are tentatively planning to start the session, a series of sessions to hear from Kip Sullivan on causes and flawed thinking on the current state of healthcare payment or healthcare financing. We also, big news, we applied to table at the 2021 Twin Cities Pride Festival, which is happening in the middle of July this year instead of June, because of course, it was put off a little bit because of the pandemic and vaccination rates, but they are holding it. It's going to be in Loring Park again. We registered, and we just got confirmation late last evening that we are confirmed as a vendor to table and provide information. Our first event like this was 2 years ago. It was extremely successful. I highly encourage people to volunteer. I don't have an electronic sign-in form for this, but if you would go to the chat and indicate whether that you might be, even if you think you might be available to help us staff the table. The first time we did it, we did 4-hour shifts. It's a really great opportunity to talk to a lot of people about an issue that is a great need in the LGBTQ plus community. So if you think you might be interested and available that weekend, even for a few hours, please put your name and contact information in the chat. We're also planning some social media training to increase our use of social media sites. I'm guessing that a lot of us are in my generation and social media doesn't come naturally to me, so we're going to do some training on that. We've got a great social media team who is putting out more information on Instagram. We're going to up our use of our Twitter account. And we would like people to amplify those, go in and retweet and resend those posts. Again, see the calendar on our website for other events. And then please send in scheduled events for your local groups. We'd like to get those on the calendar. And we are also can certainly provide speakers. It's actually a lot easier to provide speakers for video conference speaking opportunities. So this is a little picture of the book that Wendell Potter wrote, apologizing for his part in the commercial insurance industry impact on our system. And he also wrote Nation on the Take about the influence of dark money on our political system. And then again, the more you know, lots of great resources on this slide, including short videos on the Fix It website, which can help with conversations. You don't have to have all the answers. There's lots of information on video to answer the question about why should we change, how will we pay for it, and so on. Senator Marty's book, in my opinion, is a must read to understand the Minnesota Health Plan. You can go to our website under the resources tab and actually download it. And I can get you a copy as well if you would let me know that you want a physical copy. Physicians for a National Health Program website is an excellent resource. And other useful resources, Rose referred to a number of other national movement leaders, and those are how you can tap into their information. Again, and Wendell Potter has a newsletter, by the way, or a couple of them. One is called tarbell.org and another one is Center for Health and Democracy. Enormous amount of great information if you sign up to get those newsletters. And then a new book that lots of us are reading, newer, Medicare for All, A Citizen's Guide, covers how we got here, descriptions of policy specifics that we're going to have to consider, and most importantly, a discussion of the politics surrounding this issue and what it will take to change it. And my challenge for you today is that in addition to enjoying some relief as vaccination rates increase and it becomes safer to get out in public, my challenge to you is to think about what you will do when you leave this meeting today. What will you commit to doing to fix this? Rose already described this is kind of my one last thing, a letter that was sent to the president and the vice president by members of Congress. They were all members of the House, I believe. And it asks for an expansion of our current Medicare system. So I put a few of the similar information in here that you can use when you contact your member of Congress, either to thank them for signing or push them to consider this expansion of Medicare as a great policy step. So I will end with saying, giving my contact information here. And thank you for attending. I would also like to bring up Carol. I'm going to actually stop sharing. Carol, do you have anything to share or just?
Yes, I do. I absolutely do.
Okay. All right.
Thank you for everybody during this meeting to giving to our thon. We are now only $340 short. And all that money that you give, besides a little bit of tip for giving to help us run this site, goes 100% to Healthcare for All Minnesota's needs to build this momentum. So thank you so much. Now we are sharing the Wendell Potter event with Center for Health and Democracy, but right now I am going to go show you exactly how to do this. There's been some questions about that. Let's see, share. Okay, so when you go to our website, all you have to do for the Exercise-a-thon, sponsor a team. We're very fortunate that Renee Cardarelli and Chuck Smith-Dewey helped us put this right on our website. So let's go to purchase tickets. We did get 3 more for this event. So let's see where we're at now. Up to, actually it starts from 50. So I'm going to thank you very much for the people that gave. And I wanted to get a total of 7 more. So I'm going to go look at that right now to see where we're at. In just 1 minute, I will have it looked up so that we can know where we're at. Okay, we had 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. We made it. We wanted to get 10 more live. Now, if you want to join too and purchase a ticket and I go over the 10, believe me, I'll be still cheering because this is how we do it. This is how we do it. We've come together and this action, every action, let me stop sharing here. This every action site, we need funds to run it. And we need funds. We have an expert consultant now helping us set up phone banks, pull lists out. There is so much we can do. If we work in the Dean Phillips area, we can pull out voters and we can survey people that are willing to come to a rally or a meeting with him and do real activist work. But in order to do that, we need to have money to fight big money. Because the millions and billions that these big corporations and insurance companies and big pharma has. And let's not forget Nicole Smith Holt as one woman activist and getting money for type 1 diabetes and Minnesota Insulin for You brought us all together to fight for an emergency insulin bill that is in place now. And that is one step towards getting things better. And now they have a bill in Colorado and they've had a bill in several other states that are going towards this. So thank you very much. The other thing I need is people to sign up in the chat for the phone banks. It's very important that we can phone people in the next week because people are just overwhelmed a lot of times with emails and we need to just do a personal ask to tell them what, and here, Ann put it in there again, thank you, for the forms to sign up for the Google Doc in order to do phone banking. And that is very helpful if we can do that. I can't tell you how many times when I've called that some people get us confused and they think I'm going to call to give them health insurance. So it's important that even if we do these flyers out in public, like at Lake Harriet, Minnehaha Falls, what we're doing is advertising who we are and what we're doing. So with that, I am going to thank you very much. Thank you.
Thanks a lot, Carol. You're amazing. Actually, the electronic form that I put in was a sign in for the meeting today.
Okay.
We do need to really improve our data collection and our database contact information. But if you are willing to help with the phone bank, either look for Carol's form
I'll put it on right now. I'll put it in again.
Or put your name and phone number in the chat. And otherwise, and if you would like to help us with the Twin Cities Pride Festival in the middle of July, please volunteer here as well if you can commit today, even if you just think you might be available. So I guess with that, I'll say thanks a lot for attending today. We will be sending out the slides from this meeting, plus Rose's slides, so you'll have all that information, including what Don reported. If you've been waiting to purchase that ticket for Wendell Potter, the June 22nd event, we will also hear from Rose that evening, and we're going to hear that the team has, the fundraising team has been working so hard on this. We've got great videos, which include personal stories. I think it's going to be a great event. So interesting, probably the biggest thing we've done so far. So thanks to Carol's leadership on that. Look for upcoming.
I just want to let you know that I put the form in again for the phone bank in the chat. So if anybody can help, I really appreciate it. Even 5 more people to help us would make a huge difference. And the script is all made out for you. Renee did a fabulous job of getting it set up, doing every action. We're actually using this rocket ship in the right way finally. Thank you.
Thank you. Okay, unless Mark, do you have any final thoughts? Anything you need to say?
No, I think it's been a great meeting. And I want to thank all the participants and all of the panelists for doing a great job. And I hope everybody has a fine rest of their weekend.
Okay, that concludes our meeting for today. I'll wish you a great rest of the day as well. Thanks a lot.
I apologize. I had a hard time with getting my PowerPoint would just froze on Zoom. So what I should have done was just kept the slides off to the sides and gone back and forth. So that's why I kept resharing my screen. It just wouldn't move forward. If I clicked to enter, if I did my mouse, my PowerPoint froze. I don't know why.
We will we will soon end our recording. And then if the panelists would stay on, we can debrief a little bit.